Again, I apologize. I'm just having problems with the recording. The videos, it just seems to keep stopping. So again, if you just be patient with me, I apologize. I'm almost finished with the video. The second test for that you can do for the hip is called the Patrick's or the Faber's test. And what it is you take this left leg, you take the foot of the left leg and place above the patella part of the right knee. You press down on this area here. Okay, if there's a problem when you press there with that knee coming down to the exam table, or if there's pain or anything, that's a positive sign. It's how you check for sacroiliac joint disease. If there's pain or anything like that, like I said, that the patient feels or they're unable to get it down to the exam table, there could be some issues going on there with the hip. So we're going to move on to the spinal portion of the exam, which is the final area of the exam. So what I'm going to do right now is I'm going to be inspecting. So can you come stand in front of me? Hopefully the camera can see. Right now when I'm looking for I want you to spin around. Okay, so there you go. So right now I'm going to be looking for shoulder symmetry. I'm assessing the height. I'm looking at the overall spine. I'm making sure that, I'm checking for any kind of cervical or lumbar lordosis or dorsal kyphosis from the side. If you can turn sideways for me, please. Looking to make sure everything is toward the camera. This notch here is nice. There's nothing abnormal in terms of the curvature of the spine. Can you go ahead and face me frontwards? Shoulders, everything looks symmetrical and even, and there's no one shoulder higher than the other which is causing any concern. Face that way for me, please. Even from the back again, everything looks nice and symmetrical. What I'd also do at this particular point is I'm going to have you bend forward for me, and as you're bending forward, okay, I'm looking at the fluidness of the movement. I'm assessing and checking for any type of scoliosis. Can you stand back up for me? And with that movement to check for any type of scoliosis, I'm looking to make sure that the skin creases below the buttocks are symmetrical, which they are. I'm making sure that when the patient bends forward, everything looks symmetrical. Like I said, there's nothing higher than the other, which there isn't. I'm looking for any kind of deviations. The range of motion was good. He bent forward. It was very fluid. Like I said, there was no problem. There were no issues. So as far as I was concerned, that would be considered a normal inspection of the back and checking for things, even like I said, from the sides for light kyphosis and lordosis and that sort of thing, in terms of spinal abnormalities. As far as range of motion, this is going to be an active range of motion. So if you can face me, it's going to be lateral bending. Can you bend from down the left side and then the right side? Okay, and then I'm going to have you bend towards me. Okay, and then I'm going to have you, right now I'm going to have you go ahead and twist your shoulders to the right, twist your shoulders to the left, okay? And then now what I'm going to have you do, again, turn around this way so for the video to be able to see. I did it earlier in the video when I was talking about when I did the upper extremity, and I was checking these areas, the rhomboid muscles and the trapezius and the paracervical and palpating. But I'm going to say it again for this section of the spine because it is in this section. The intervertebral spaces, just palpating, feeling the spinal processes, making sure I don't feel abnormalities. Do you have any pain or anything? Everything feels good. I don't feel any lumps, nodules, anything abnormal. There's no pain or discomfort, he said, that he feels in terms of me palpating. And then what I'm going to do is also percuss the spine using the ulnar surface of my fist. So again, what I'm going to do, I'm going to go ahead, I'm going to do my non-dominant hand, okay? Any pain or anything? Okay, no pain? All right, good. You can have a seat. that concludes the video. Again, I apologize for the several pieces that were interrupting, but for some reason I'm having some issues with the video that's cutting off. I'll get it uploaded, and thank you for watching.